Good afternoon, everybody. I'm joined today by Dr. Rachel Herlihy, our state's lead epidemiologist. She's going to talk about the exciting news about the FDA approval process for 12 to 15-year-olds. We're also joined by Paul Lopez, Denver's clerk and recorder, and Antonio Mendez, who are going to share stories about reconnecting with loved ones after getting vaccinated, something that we're all really celebrating, the triumph of modern science with the 3 safe and highly effective vaccines, one of which will very shortly be available for 12 to 15-year-olds. I want to walk you through our progress on vaccinations, where the pandemic is now in Colorado. Before we get to that, I do want to turn it over to Dr. Herlihy. There was a big milestone yesterday. Finally, we were thrilled. Good news about getting our kids vaccinated. The FDA has given emergency authorization for the use of Pfizer for 12 to 15-year-olds. Now it's pending approval by the Advisory Committee on Immunization Practices. We expect that to come tomorrow. So I've been getting a lot of questions. When can I get my 12 to 15-year-old vaccinated? The answer is very likely as soon as this weekend, hopefully as soon as Friday, Saturday, Sunday. You'll be able to do that. The how, it's the same way you do it, meaning it's at any of the vaccination centers, local pharmacies. The parent or guardian should bring their 12 to 15-year-old. Of course, you can also do it at your doctor's office. I'm going to turn it over to Dr. Rachel Herlihy to provide a very exciting update about the efficacy of Pfizer in 12 to 15-year-olds. It actually showed an even higher level of efficacy in the trial than it did for older folks, and this is going to be a big part of ending the pandemic in Colorado, and I know parents are extremely eager to get their teenagers vaccinated. So with that, I'll turn it over to Dr. Herlihy.
Good afternoon. Yesterday, the FDA announced that the Pfizer vaccine is now authorized for emergency use authorization in adolescents aged 12 to 15. This is another important milestone in protecting Coloradans and ending the pandemic. Pfizer conducted robust clinical trials to ensure the vaccine's safety among 12 to 15-year-olds. The trials showed that the vaccine has 100% efficacy among this age group. The trials showed that none of the trial volunteers who received the vaccine went on to become COVID-19 cases. Youth are currently accounting for more new cases in the state, as many older Coloradans have already taken the opportunity to receive the vaccine. In fact, our highest case rates currently are among middle school and high school students in the state. We want to slow cases among youth in time for fall school return. As a parent and physician, I am personally thrilled about this announcement. CDPHE awaits the Advisory Committee on Immunization Practices recommendation before allowing providers to administer the Pfizer vaccine to young Coloradans. The committee will meet on Wednesday to vote on a recommendation for this age group. We are hopeful the vaccine will be available to 12 to 15-year-olds in Colorado as early as this week. Once ACIP makes a recommendation, any vaccine provider that receives a Pfizer allocation will be able to administer the vaccine to this age group. Our community vaccination sites also will be able to administer the vaccine to individuals aged 12 to 15 when the time comes. We are working with our providers to prepare for this exciting change. Thank you.
So, you might say, well, what if you're 16? And for those who don't follow it closely, it had already been approved for 16 and up Pfizer. So 16 and 17-year-olds have been able to get Pfizer all along. I went to actually a clinic at Rangeview High School just last week where some 40 or 50 members of the Social Justice Club put on a vaccination clinic for their 16, 17, and 18-year-old classmates and their families, very successful. So now it'll be 12 and up for the Pfizer vaccine. So you're going to want to inquire to make sure that the Pfizer vaccine is administered at that site. While we think it's very likely that the Moderna and the J&J vaccine will also work on young people, they are not approved for use on young people. The clinicals are underway on Moderna, but the paperwork is not yet approved and ratified. So again, make sure that it's the Pfizer vaccine at the site for 12 and up. That will be at all of our large-scale vaccination sites. We'll be able to serve 12 and up. Again, as soon as Friday or this weekend, again, as soon as they act tomorrow, that could begin as soon as Thursday of this week. But for parents that are counting on it, I think starting this weekend is a good plan to get it done and get the first dose, the second dose, and if for some reason their guardian or parent hasn't had it yet, you can get it alongside your 12 to 18-year-olds when you take them in. And thanks to the FDA's decision, all Coloradans 12 and up are that much closer to being able to be protected and end the pandemic. Over the past year, Colorado students have had to overcome overwhelming odds just to be a kid. It took on a new meaning, having to remember to leave the house with a mask, the difficult first semester where some school districts were online only. And getting the students a vaccine is not just about, of course, protecting lives. It's also about making sure that our kids are able to experience everything that schools have to offer. Again, visiting friends and family without fear of them being exposed to COVID-19. And with the approval pending tomorrow, which we're expecting, we're looking forward to start protecting every Coloradan age 12 and up. Latest COVID numbers for our state. We have an update today, 1,284 new positive cases. That's an increase from the day before. Good news on hospitalizations, down 22 to 631. And the number tested was quite low. For the 1,284 positives, there were 10,677 cases tested. So that's a spike in the positive conversion rate on the test. Keep in mind that often happens on a Monday, Tuesday. So we'll really see a lot more as we get to the tail end of this week. And it's too early to say whether we see a trend in hospital decreases or not. It's certainly something we'd like to see, but sometimes we don't see everything just because we want to see it. 22 fewer, certainly a good day, down to 631, still considerably higher than where it was a month or two ago. This is a really turning point as we enter more and more vaccinations for the virus. And we've now focused, of course, first on protecting our most vulnerable. And that's because people 70 and up represented 78% of hospitalizations in our state. Then we did the next phases, ultimately opening it up to everybody. And now, hopefully very soon, everybody age 12 and up. It's already 16 and up. And we set ambitious goals. You might recall we said we wanted to get at least 70% of people 70 and up protected. We did. In fact, we now have 75% of people aged 70 and up and protected, 76%, and we have 85% of people aged 70 and up that have had their first dose. So we have an additional, 9% that's well on their way to protection. So very shortly, we'll be at 85%. Protected for that most at-risk group. And very soon, we'll be at 76% protected for the next most at-risk group, age 60 to 69. We're currently 63%, but there's a lot of folks that have had one dose and are waiting their second. So we'll all breathe a lot easier once we get to those numbers in the 80s, high 70s for those that are most vulnerable. And I'm glad to say that we're on the way. It took a lot of work with increasing availability of the vaccine in every way, shape, or form to make it convenient to people without cars, who can't drive, who are in remote areas. And we've been doing that work. And with that work comes a decrease in death rates. This virus can and is fatal to people of all ages, tragically. We've lost young people in Colorado. We've lost old people in Colorado, but it's far more fatal for people over the age of 70. And then, of course, the next cohort, 50s and 60s. And now it's one of the reasons that we're glad to say that vaccines are eligible for everybody age 12 and up. It is about kids. This is a health threat to kids, but it's also about kids as transmission vectors across society and about ending the pandemic. As the state of Colorado gets ready to further the development of the vaccine, we've been focused on making it available wherever people want it, how they want it. And a big part of that is our vaccine equity outreach team. This is the team that's created hundreds of community partnerships. I was at Salvation Army yesterday. They've been in church parking lots. They've been working with community organizations across the state to be able to make the vaccine available where you are, in a very convenient way. Rural communities, low-income communities, LGBTQ plus immigrant communities. I went to one in a mosque working with our Muslim community, and many others. And that's in addition to our large drive-through sites, in addition to our hospitals, our community health clinics, there's many medically underserved Coloradans who don't have that kind of relationship with a hospital or don't feel comfortable going there and would feel comfortable going a few blocks from their home. And we've really found that to be the case. That's one of the reasons that Colorado continues to be in the top tier of states in successfully protecting our fellow Coloradans and ending the pandemic. The Vaccine Equity Task Force is really focused on leveraging federal, state, local, community, and the key part, private partnerships, meaning community-based organizations, nonprofits who have the trust of their community. And we've stood up about 1,250 first dose and second dose clinics. That includes our mobile vaccine clinics. We have 2 mobile buses. There I am visiting some of them. I think one of those that I'm visiting is doing one for Special Olympic athletes, which is really exciting to see Special Olympic athletes 16 and up vaccinated. Now we'll be able to do a similar partnership for everybody age 12 and up. We also have several mobile vaccine clinics. They were parked at CU campus the other day at Willville. It was very convenient for hundreds of CU students to come up and get the one and done Johnson & Johnson vaccine to get protected. But we were proud that we've now delivered over 5,800 doses with our mobile vaccine clinics in Northeast Colorado, Southwest Colorado, Southeast, Metro Denver, Western Slope, 82 stops for the 4 buses. There were 2 initially. There's 2 more that just hit the road recently. And that there's more than 80 stops along the several different bus routes that are scheduled just during the next 2 weeks. They're scheduled about a week or 2 ahead. And from Lamar to Los Animas to Denver to Delta, you can check out where the buses are at mobilevax.us/clinics. That's mobilevax.us/clinics. No appointments needed, just as there's no appointments needed in pharmacies, no appointments needed in drive-through sites. You certainly can register in advance if you're nervous or want to make sure, but they absolutely have vaccine for you. Just show up during business hours. You will get it. There won't be a wait. And that reminds me of the large-scale sites that are in many ways the easiest way to get it. If you have a car, if you can drive, bring the whole family. Starting Friday or Saturday, bring everybody 12 and up. And you can go to Adams County Dick's Sporting Goods, and that's Sunday, Monday, Tuesday, Wednesday, Thursday, Sunday through Thursday, 9 a.m. to 5 p.m. Denver Ball Arena, which was, some of us think of as the Pepsi Center still, Ball Arena, Monday through Friday, 7 a.m. to 7 p.m., and Saturday, 9 a.m. to 4 p.m. Again, if you have a 12, 13, 14-year-old, you can go there this weekend to get them vaccinated. If there's other family members that haven't yet been vaccinated, to bring them along as well. The Broadmoor World Arena in El Paso County, Friday through Tuesday, 10 a.m. to 6 p.m. In Larimer County and Loveland area, the Ranch Events Complex, Monday through Saturday, 10 a.m. to 6 p.m. In Mesa County, the Grand Junction Convention Center, Wednesday through Saturday, 9 a.m. to 7 p.m. Pueblo County, we have the Colorado State Fairgrounds, Monday to Friday, 9 a.m. to 5 p.m. And again, very soon, starting this weekend, everybody 12 and up should be available as long as that announcement is made tomorrow that we expect. But in the meantime, everybody 16 and up is available for the Pfizer vaccine. At most of these sites, they also have the J&J vaccine. So if you don't want to go back, if you just want one dose, that one is also safe and highly effective. And you can take advantage of that as well. We found a lot of demand for that, particularly on the mobile vaccine front. That's the one that they were doing over at Willville 2 days in a row at CU. Very successful. We recently, and these are the display of where those sites are. So these are large-scale sites. Your local pharmacy, CVS, Safeway, King Soopers, they should also have the vaccine. Generally don't require vaccines. If you're picking up groceries and you haven't gotten it yet, take 10, 15 minutes and go ahead and get it there. Of course, also hospitals and community health clinics also have that vaccine available. So we want to end the pandemic, help you protect yourself, and make it as convenient as possible for you to do that. We announced the Power the Comeback campaign several weeks ago to meet the needs of Coloradans. The campaign, like Colorado, is unique. We're using non-traditional strategies to form coalitions and get the message out in English and in Spanish about how to get good information and schedule your vaccine, text message program to help folks really have the plans they need to get vaccinated. And those ads are running on TV, radio, online, social media, and of course, coming soon to a business near you. You can get informative text messaging in English by texting vaccine to 855-355-4566. You can also test vacuna in Spanish to get Spanish information. It's really remarkable to see both nationally here in Colorado how effective these vaccines are. 94.6% effective at stopping the spread, but even more effective than that at preventing severe symptoms. It's really exciting and inspiring to see. And we are doubling down on working with trusted community organizations to help get the vaccine out. One of the new programs we're offering, and this is if you're watching this and you work in a large workplace, we're offering a new workplace vaccination program. That means we can work with the employer or the union or the trade association of any size, you 30 employees, 300 employees, 3,000 employees, to have a very simple on-site vaccination event. And I've been to on-site vaccination events at U.S. Postal Service and other companies. They're very successful. People can just get vaccinated right over their lunch hour or on break. If you are at an employer, work in HR, run a small employer, run with a trade association, and you'd like to get on-site vaccination for your folks, you can go to atworkvaccinationsco.com, atworkvaccinationsco.com. You can sign up there. We'll be able to get that going with you in the next week or two. We're very excited to make that convenient to employers of all sizes across our state. As a reminder, employees in Colorado do get 4 hours of paid time off for vaccine appointments. I would add that many employers, as a best practice, allow employees to stay on the clock for the entire time that they're getting that. Some have even given a day off for people to get it. But the 4-hour time off is what we are using as a best practice. And if your employer is not, you can absolutely tell our Department of Labor and Employment Division of Labor Standards. They would like to hear if there are any violations. 303-318-8441. And you can ask questions or of course, voice a complaint. You know, getting the vaccine should be so easy. It also should be as easy as seeing your doctor, and we're making a big push to get it into the hands of more family practices and pediatricians now with the expected approval of Pfizer for everybody aged 12 and up. We're collaborating with the American Academy of Pediatrics, Academy of Family Physicians, Colorado Medical Society, to make sure that our frontline doctors are fully prepared to be able to do that as well for people that have formal doctor's appointments or are coming in for something else, just to be able to offer that. So it's all hands on deck. It's every way from Sunday that this is available. Your local pharmacy, stand-up clinics, the buses, the big drive-through centers, your hospital, your community health clinic. And we just want you to do your part. And that just involves rolling up your sleeve and getting protected. And many of you have. And I know you have the peace of mind that that brings. Many of you are still waiting or want to make sure it's convenient to you. It now is. And I encourage you to go ahead and do that. To find out more about where you can get the vaccine, you can simply visit cocovidvaccine.org or dial 877-CO-VAX-CO. They're happy to connect you with a provider in your area, probably just less than a mile or two from where you live, to be able to get that on your commute to work, wherever that might be, or just stop through any of the large 6 state sites anytime. The comeback isn't just about how our small businesses, large businesses can thrive. It's also about the comeback of love and family and how we can reunite with people that we love safely without jeopardizing their lives after a year of having to stay apart. After a year of separation, Paul Lopez and also Antonio Mendez were able to spend Mother's Day with their mothers who gave them life because of the great protection that they're vaccinated and their mothers are vaccinated. First, we have Antonio, a Coloradan who is in New York visiting his mom, joining us virtually right now. Are you with us, Antonio?
I'm here, Governor Polis. Thank you so much for inviting us.
How does it feel to be able to safely spend time with your mom again?
It feels fantastic, and this is her. This is my mom, Juana. She says hi. And we feel great. It feels fantastic to see each other, hug each other, spend some time together. It's been 14 months since we've seen each other. It means a lot to be here.
It's great to see you, and I'm glad that you're able to do that. And do you have how does it feel to have that peace of mind, knowing that you're not risking her life by seeing her?
Oh, it's incredibly important. It's the reason why I spent 14 months apart, right? She's so important to me, and I didn't want to risk her in any way. So I made sure the moment I got my vaccine, I also booked a flight to come here and see her.
And isn't it nice? No masks, no anything. You just get to be right near each other, hug each other. It's a wonderful thing.
It is. We're following all the CDC guidelines, but we're indoors, so we can be without our masks because we're both vaccinated.
Well, bless you and bless your mom, and we hope that you invite her to visit us in Colorado sometime soon.
Definitely will do. Thank you, Governor.
Thank you. We also have Paul Lopez with us, who is the clerk for the city and county of Denver, but he also, of course, has beloved family members that he is now able to see now that he's vaccinated without having to worry. And with that, I'll turn it over to Paul.
Thank you, Governor, and thank you, Doctor. I know Antonio, and it's so nice to see him smiling and happy. As Governor Polis said, I'm Paul Lopez. I have the honor to serve the city and county of Denver as their clerk and recorder. I just got to say, during this past year as essential workers, our team worked in person very hard on the counters, working the elections to make sure that our continuity of government, or our government continued even during the pandemic. We were able to carry out elections, 3 of them, do it in a way that was transparent, that was secure and safe, and everybody remained safe the whole time. So I have to thank you, Governor, and so many folks around the state and our nation for making sure that those protocols were well communicated to folks, and we continue to do that. As you can see, this is my mother, Yvonne, and this is my daughter, Nayeli. Nayeli's 13, she's going to be 14. And I could tell you, as a dad, it made me really happy to know that my daughter was going to be able to be vaccinated, because this has taken a toll on our young people. They're strong. You know, she was virtual in virtual classroom the whole year. But I can tell you, not being able to hug your grandmother or be with your friends, that takes a toll. It was hard on all of us, but there's light now, and you have access to the vaccine. So I want to encourage folks to go get vaccinated. And I also want to say, as a man of color, I got to speak to my fellow men of color. I know some of y'all think you're tough, but the virus doesn't care how tough or macho you are. It will snatch you. It will hurt you. It can kill you. And as a dad, as a father of my little girl, and even as a son, I didn't play around. When the vaccine was available, I lined up. I could deal with a sore arm. I can deal with body aches. I'm from Colorado. We have thin air up here. We're used to that, right? However, I took that vaccine because it's important for me as that man in my family and that father to be able to remain in my daughter's life, to watch her walk across a graduation stage, to be able to hug my mother, to buy her lunch and take her out on Mother's Day, to finally hug her after a year of not being, 14, 15 months of not being able to hug her, right? Those days are precious. And I have to say that our family members, fellas, depend on us to be smart, not macho. They need us to stay in their lives so that we can do everything that we are supposed to do as fathers, to be there. And I know that the rates amongst young people are relatively low, very, very low in terms of fatalities and serious illness. But even then, if it's not 100% sure that I can take care of my daughter, I'm not going to play around with even a fraction of the percentage. Even a fraction of a threat to my daughter's health is going to require me to act in every possible way that I can. So, like many of you, I didn't get to hug my mother, but now can because of the vaccine. Thankfully, as you see, I got to celebrate with her, my daughter. But with vaccines now being approved for teens age 12 and up, I know it's going to be really important. And I urge you, please get vaccinated. Thank you, Governor.
Thank you, Paul and Antonio, for sharing your stories. And there's so many other countless stories. If you're watching this on online streaming, you can share your story below of being able to visit with your mother, your father, your aunt, your uncle. We're excited that Colorado continues to be a leading state for vaccination progress. We are looking forward to ending this pandemic and moving forward with the Colorado comeback. Sadly, we've lost over 6,500 of our fellow Coloradans to COVID. And life is precious. I think we've all learned how precious it is, the gift of health, the gift of life this last year, in addition to the 6,500 people we've lost. Tens of thousands of more have been hospitalized, have come up right up close against death and stared it in the eye and thankfully come out the other end. Some still have lingering health impacts. The vaccines are amazingly effective. Please take advantage of this triumph of modern science to protect yourself, your family, and get back to the Colorado we love. Getting the vaccine, giving a hug to your loved ones without worrying about threatening their lives. A more normal July where you hang out with the people you love, with a cookout, and or eating at your favorite local restaurant where people are vaccinated and where you're safe. We don't have to just imagine this. That future is ours. That future is here. Together we can empower one another to save lives and end the pandemic. And the biggest step we can take, if you have anybody in your family age 12 and up, and if you haven't been vaccinated, by all means go with them and get vaccinated as well, starting as soon as this weekend. People of all ages, there's many ways to do it. Take 15 minutes out of your day. Protect yourself. Happy to take some questions. Mm-hmm. We are, as soon as they request it, we want more pediatricians to take it. Many pediatricians that are linked with larger hospital chains already have access to that, but I plan on doing a call soon with pediatricians, encouraging them to have that and to offer that. Every pediatrician should offer it to every person age 12 and up whenever they come in for a checkup or any other reason, and I think we'll probably be there within a couple weeks.
Governor, good afternoon. This is David Clue at Denver 7. I want to ask you something about the current legislative session right now. As you know, House Bill 1214 will seal certain criminal and arrest records. Many are calling this anti-business, as it would prevent companies from doing adequate background checks on prospective employees because it would seal many criminal convictions. Will you support this bill if it arrives on your desk?
Well, look, we follow a number of bills during the legislative process, and we are happy to help supply any input to the sponsors and others if they ask for our help. There are, of course, already ways that juvenile records are sealed, and many are. This extends that further. And of course, we're happy to look at this or any other effort to balance, of course, the need to protect the privacy of minors with the rights of employers.
Governor Charles Ashby from the Grand Junction Daily Sentinel. A couple of questions related to the 12 to 15, if I may. So I'm looking at the numbers for Mesa County and noticing that our largest outbreaks among age group in the last 2 weeks have been among kids aged 10 to 19. I'm wondering if that's also a statewide thing. And along with that, I'm wondering, I know you said that parents can bring their kids in hopefully as soon as this weekend, but are you going to be working with schools to have them vaccinate kids with parental permission, and how's that going to work? And I do have a follow-up.
Yeah, so we are excited to partner with schools, really the same way we partner with other organizations. And you can sign up. I'll give you the website again. I'll find it here. A lot of pages. @workvaccinationsco.com, and that can be a school. And that's exactly what we did at Rangeview High School in Aurora. Student run. They put on a session for people 16 and up, and there were parents that came in, and there were fellow students that came in. That will become an even easier thing to do with age 12 and up. And we're really thrilled to work with any school, PTA, teachers, administrators to get that done. Yes, we do see the biggest increase in rates among teenagers, and it's not rocket science why that's the case. We have a certain percentage protected of every other age group, and at the older age groups, it's very high. 80% of people 70 and up. When you get into the 20s, 30s, 40s, maybe it's around 40%. It depends on the exact age that are protected. But when it comes to 13, 14, 15-year-olds, it's currently 0% that are protected through the vaccine. Some might have additional resistance from a prior infection, but even that is not nearly as effective a level of resistance as the vaccine can provide. So yes, the best way we can make progress in reducing the rapid increases in the COVID rates among teenagers is by ensuring that people age 12 and up are able to get safely vaccinated promptly.
I did have a follow-up, if I may.
Yes.
And I think for Dr. Herlihy, I found out yesterday that the 5 India variant cases were in fact connected or may be connected. What do you see on that statewide? Is that concerning you, that variant out there? What's going on with that?
Yeah, so the variant from India that you mentioned, the B1617.2 variant that was identified first in Colorado last week in Mesa County, we are certainly working closely with Mesa County public health officials to investigate that cluster of cases. Like all of the other variants we are investigating right now, we are certainly concerned about these variants. We know that a number of them can be more transmissible, so infections can spread more readily. We have a lot more to learn specifically about this particular variant, the B1617.2 or India variant. But at this point, it certainly is concerning and is a challenge for us right now to control transmission when we have these variants that are spread more easily in the state.
Hi, Governor. This is Joe Vaccarelli from Denver 7. The county commissioners are voting later today on a resolution that would lift all mask mandates in the county and lift fines that were related to not following some of these guidelines. What is your reaction to that? Is that kind of action concern you? Should it pass today?
Well, I think taking symbolic actions that discourage mask wearing are short-sighted and unscientific. I encourage all Coloradans to follow CDC guidelines with regard to mask wearing. To be clear, those are not the requirements in Colorado. There is no indoor mask wearing requirement if there's less than 10 people. And if there's more than 10 people, wear a mask indoors unless everybody's vaccinated, in which case you don't need to wear a mask. We have a lot more individual responsibility, and we respect, freedom as a value a lot more than the CDC guidelines. But we encourage people to follow those CDC guidelines. So, again, if you're not comfortable being around others, or if you haven't been vaccinated, the best advice I can give you is wear a mask. I would hope that there's similar advice from our commissioners across the state to empower people to make the choice that's best for them to protect their lives and protect their others. And one of the tools we have to do that is a mask. Now, a mask is not as effective as a vaccine. A mask is about 50% effective. Some studies say a little bit lower, some say a little bit higher. The vaccine is over 95% effective. Big difference. And even in the 5% for that vaccine, those cases are much more minor. If you have a mask, 50% effective, but if you get it, it's just as bad as if you didn't have a mask. The symptoms aren't any more mild because you wear a mask. They're the same. With a vaccine, it is much less clinically dangerous. If you get the virus after getting vaccinated, you're likely to get a more minor case. So for all those reasons, get vaccinated. Until you're vaccinated, the mask is about 50% effective, and I certainly encourage people to wear them when they are around others that are unvaccinated.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado. Gobernador, en español, ¿puede decirnos cómo se prepara el Estado para vacunar a los niños de 12 años en adelante?
Estoy emocionado por la noticia de ayer de que la FDA aprobó la vacuna Pfizer para niños entre 12 y 15 años de edad. Cuando sea oficialmente aprobado mañana, podrán vacunarse de la misma manera que los otros coloradenses en cualquier lugares, farmacias, los lugares grandes como Ball Arena, como Dick's Sporting Goods, su clínica de salud, su hospital, su farmacia de barrio. Es muy fácil para los jóvenes de Colorado recibirlo. Ya pueden recibirlo cada persona mayor que 16 años y muy pronto, empezando este fin de semana, todos los coloradenses mayor que 12 años pueden recibirlo también. Paul?
Gracias, gobernador. Y sí, no, eso es cierto. Es importante que nosotros actuamos inmediato para nuestros familiares. Ya ves que la semana pasada, pues pasé el Día de las Madres con mi mamá por primera vez en un año y con mi hija. Así que ella podía estar con su abuelita, darle un abrazo fuerte después de un año de no tener esa oportunidad. Así que es importante que nosotros, particularmente los hombres latinos y personas de color, que hagamos estas vacunas. Es importante saber que no importa si una persona piensa que es muy macho, que no me va a afectar, a este virus no le importa, te puede matar. Y es un riesgo a su familia. Yo como hombre, yo como padre, no voy a tomar ningún riesgo así sinceramente. No, nosotros tenemos la responsabilidad de proteger nuestra familia y nuestra comunidad. Así que haga su parte, toma la vacuna.
Well, we have been getting enough vaccine to be able to offer it at all the sites. We have been, the last week or two, we have been trying to build up some Pfizer, knowing that this news was going to happen about 12 to 15, meaning we've been trying to get more Moderna out, knowing that we likely won't have enough to get every 12 to 15-year-old done in a week or two. It'll take a few weeks to get through everybody. But we do have Pfizer doses such that at all the state sites and many other sites we'll be able to begin with the 12 and up starting this weekend. We were on a call with the White House today where they announced next week's allocations. The allocations are stable. The Johnson & Johnson allocation is very low the last few weeks. That's because there's a facility in Baltimore that the federal government has several million doses from, and they need to clear the approval from that facility before they send those. But so right now there's a lack of significant dosage for that. But again, because of the pause, we actually have some. So we're continuing to be able to use Johnson & Johnson until we run out or the federal government gives us more. So I think we're in a good supply situation to meet the need. There might be a little crunch on 12 and up. It might take a few weeks to get through everybody 12 and up, depending on how fast parents avail themselves of that opportunity to protect their kids.
Throughout the pandemic, you sort of shared with us your holiday plans. With your birthday coming up and now that you're vaccinated, do you have any big plans? Do you plan to go out?
Yeah, I'll be going to the Rockies game tomorrow.
Last question from the phone. Next one.
Hey, John Frank here. Just one question for you about the vaccines. I'm wondering if you think there's any settings that should require a vaccine to enter, whether it's a baseball game, a restaurant, or airplanes. Is there any situation where you feel like vaccines should be required?
Well, that's really up to individual businesses. I know there's some that are worried about the safety of their own employees and have taken those steps. There's others that want to provide those assurances to their customers and feel that there's more customers that will come if they ensure that a certain percentage or all the customers' employees have been safely vaccinated. So I think you'll see a wide spectrum in Colorado and across the country. You'll see some folks that don't care that much, and businesses that don't care, and they're not advertising or marketing their vaccination rates, and they're keeping it private, and it's everybody's decision. There'll be others where, as a matter of pride, they want to assure customers that they have a vaccinated workforce, perhaps that their fellow customers are vaccinated at a certain level. And I think that there's consumers with all sorts of preferences in our state, and all kinds of businesses can continue to thrive in this environment, and this can be certainly a point of positive differentiation from all perspectives with regard to what their policies are. Thank you all very much for joining us.